Hello everybody, my name is Aubrey and welcome back to my channel. As promised, here is my yearly update after having been treated for metastatic papillary thyroid carcinoma. This year is 3 years since my total thyroidectomy and neck dissection, and I really can't believe it's been that long, but also it feels like it was just yesterday. The last 2 years have been a lot of trial and error when it comes to managing my medication, and I was told that that was probably going to be the case for quite a while, and they weren't kidding. So, I've been on many different doses and had so many different side effects pop up depending on the dose I was on. It was really tricky. I think one of the hardest things was navigating things like chronic headaches and nausea, as well as really extreme fatigue, but then also not really being able to sleep through the night. That went on for about 2 years, and I honestly don't even know how I made it through. Now that I've got a much better dose, I'm looking back on it and going, oh my gosh. But you just kind of get used to it. It becomes your new normal, and I think that's something that's one of the trickiest parts about navigating the medication is it takes a while for the medication change to become noticeable, and even then it happens over such a gradual period of time that you just kind of start getting used to stuff. And so I think one of the important things I did to help myself with that was to really keep detailed journals about my symptoms and when it was happening and how that might relate to the dose change that I had had. So if you're struggling with your symptoms, I would highly recommend you starting to do a symptom journal because it made a huge difference for me in terms of making sure I didn't feel crazy. One of the things that I'll say is this year, I absolutely am finally starting to feel more like myself, which is so amazing. For the first time ever, I'm kind of feeling nothing, which is ideal. I don't feel any particular way. There's a couple times where I'll have these kind of symptoms pop up again, but overarchingly, I feel shockingly normal. I have also been able to finally start managing other conditions I have. I haven't really talked at great length about those things on this channel because they're not really that important. But I do have Hashimoto's thyroiditis as well as rheumatoid arthritis. So the Hashimoto's is kind of a moot point now that my thyroid's gone. However, I have read that the Hashimoto's issue doesn't go away. You still have the antibodies and such, but since I don't have a thyroid, I'm not really focusing so much on that anymore. I'm really more focused on the arthritis. I started having arthritis pain a little over 10 years ago, and it was kind of tricky because I was so focused on the cancer that I definitely pushed the RA stuff in the back of my mind. So now that I feel much better and my medications for the thyroid are significantly more stabilized, I've been able to start treating my RA, which has been really nice. A lot less joint pain, and one of the biggest things is I used to have a lot of grinding with my joints, which was very frustrating. They would get very puffy and hot and red, but now that's happening more and more infrequently. And so now I'm feeling overarchingly a lot better. So both of those two treatment paths combined have really helped me to find a sense of like, I'm a normal, almost 30-year-old, which is great. I am still unfortunately having abnormal tests. One of the biggest things that I've mentioned before is I still have very large lymph nodes in the areas that I didn't have the lymph nodes removed. So in particular under my jaw. I have had biopsies on these abnormally shaped lymph nodes, but everything comes back totally clean. So basically what that means is they're not sure if it's related to other autoimmune conditions or potentially early recurrence. So I'll be having biannual scans for the foreseeable future, which I'm totally fine with. It's just head neck ultrasound kind of stuff. So it doesn't bother me. It's really quick, really easy, painless. So I'm a huge fan of ultrasounds. So if you ever have any doubts, I would definitely ask your doctor whether or not an ultrasound might be appropriate in your situation. So in addition to the lymph nodes, I do have a couple abnormal blood tests that come back, My tumor marker, or the thyroglobulin, has always been undetectable, even when I was in active disease, which means that my blood tests are not necessarily the most accurate way to tell whether or not I may or may not be having a recurrence, meaning I have to do blood tests usually every 1 to 3 months, and then my head neck ultrasounds every 6 months. Everything else seems okay. So we don't know what's going on exactly, but since nothing is rearing its ugly head yet, there's not much to do other than hurry up and wait. So I feel good. Nobody's really that concerned. I'm just being like babysat, basically. So everybody always wants to know what my scar looks like, and honestly, the scar itself looks pretty good. You can really only see it clearly when I like flex. So there you can kind of see it. But it looks really good. It's in natural lines that I have in my neck, so I'm very happy. I will say, when I get a sunburn, it gets itchy and a lot darker, so make sure you put a little extra SPF on that scar. One of the other things that's happening is I'm developing strictures, but because the scar goes across the whole neck, I do find myself struggling to lift my head, and I cannot swallow if I lift up my head too far. So usually if I'm swallowing, I have to look down a little bit in order for me to do so, because I do choke. I can't seem to get the top of my tongue to reach the back of my mouth, and it does make for kind of uncomfortable experiences. So I do have a lot of scar tissue and such that's developing and just creating some tightness. Sometimes that does affect my singing voice. My voice itself feels super clear and super clean now that there's no tumors in my neck, so that's a good thing. But because of all of the, I guess, trauma to the area, there is some tightness, and some days it's more noticeable than others, and depending on the rep that I'm singing, I can notice it, and it can definitely change how I navigate my voice. But overarchingly, my voice feels much better than it did. I had a really, really good surgeon who cared a lot about my voice, and I'm friends with my laryngologist, who also is a singer, and he was involved in my surgery and intubated me and made sure that everything was going really well. So I had a really good team at my hospital. So overall, I feel much, much better. My voice is much more consistent. I feel very happy with how I sound and how I feel. It was overall a really wild experience, and it still continues to be. So I'm really hoping that my 30s are full of joy and adventure and feeling a lot better than I have been. I think the hardest part really was feeling so fatigued and nauseated that I really couldn't keep up with other people my age and feeling like I was missing out. So one of my personal goals for my 30s is to really push myself to go on more adventures and explore and try new things. I am so insanely lucky that everything turned out as well as it did, considering that I had already had some metastasis. It was definitely scary. But yeah, overall, I feel so fortunate and so happy to be able to sit here and say that everything feels normal for the first time in so long. Being a younger thyroid cancer patient, I was always really, really concerned with how there wasn't a lot of data about what my lifespan looks like or what my quality of life looks like, because that was always really scary. I also see so much conflicting data, even about RAI treatments and what you're supposed to do, and the difference between iodine-free diet versus the thyrogen shots and all of this, and it's so confusing and so stressful. My best piece of advice for people who are dealing with this is to really get to know your doctor and feel comfortable asking for assistance or guidance. I also really encourage people to join the Facebook groups that are available for us and getting involved in the community. Talking to other people with this condition helped me so much to prepare for all these different things that I was going to have to go through. I even reached out to my own vet about what to do with my cats when I was doing the RAI treatment, because I was aware that cats can actually do the same treatment. So I really wanted to go into this feeling like I had the most amount of information and support I physically could have. I will continue to give you guys updates every year about how it's going so that you can kind of understand a bit about my experience. But yeah, everybody's experience is different, but I just hope that this video series can help give you some perspective. Thank you guys so much, as always, for tuning in, and I look forward to giving you any updates as they're related to my metastatic papillary thyroid carcinoma. Hopefully, they'll only be good ones. But until then, feel free to check out my other content, which is largely unrelated to thyroid disease. But yeah, thank you so much for checking in again, and I hope that you have a really, really beautiful day. Bye!